and I'm so glad to have you all here today. So thank you so much for joining with us this evening. So prior to the beginning of this session, I request you all to drop your queries that you have in between the session to our live chat box on the YouTube. So we will be discussing it later on our discussion session. For now, I would like to inaugurate this session and I would like to introduce our today's webinar with our speaker, Dr. Ajeet Bhardwaj, who is an M.Optom, founder and director of Optique Invasion Vihar, New Delhi. And we will be talking on topic Tele-Optometry in contact lenses and vision therapy. So, Dr. Ajeet, I welcome you all again to our Mero Eye Talks platform on the behalf of Mero Eye Academy and all our participants. Over to you, Doctor.
Hi, good evening again. This is my third topic on telemedicine, and I'm very excited to speak to my friends in Nepal. And last two topics, what we discussed on telemedicine but basically on history of telemedicine, how we should conduct telemedicine, what are the telemedicine laws in India, and what are the procedures we can do in optometry and ophthalmology field remotely. And in the second talk, which we had last week, we discussed about the latest technologies in telemedicine, how we can connect using inexpensive telemedicine platform. And this was, I discussed, I think, about a week back. And today my topic is very exciting and very close to my heart, because this is where most of the private practitioners come in. And how do we extend our contact lenses practice and vision therapy practice by use of telemedicine. So this is some topic of interest for those who are in private practices, those who wants to connect to their patients in closed down situation and lockdown situation where you don't have access, patients wants to reach us, but we are closed. And this gives an opportunity to refresh our knowledge on contact lenses and vision therapy. Well, I'll give you slightly touch upon a few aspects of telemedicine. You see, in countries where telemedicine is regulated to a greater extent, in the sense that even the insurance companies, they allow optometrists to claim their reimbursement fees. So studying the US pattern, I have seen there are 5 codes which are issued to optometry, and optometrist can claim within that reimbursement limit, depending upon the kind of different care you provide to your patients. So what are the 5 kinds of care which are allowed by reimbursement? First care in telehealth or telemedicine practice is a supportive care. Supportive care means that you can contact your patients by sending a questionnaire. You can get the history of the patient by a questionnaire, and you can get symptoms, you can get all details using asynchronous mode of consultation. And this is called supportive care, and there is the least amount of reimbursement for this. The second kind of consultation, the care which is allowed, which is given a code in telemedicine, is called consultative care. In consultative care, you can invite a senior consultant. He could be an optometrist, he could be an ophthalmologist in a specific field, whereby you and your patient are connected to that specialist to provide that consultative care. And this is my topic today on contact lenses, which I'll be talking to you about specialty contact lenses. They will be discussing more on consultative care, whereby you could invite a consultant optometrist or ophthalmologist who is more experienced, who is specializing in these fields, and he can take care of your patients remotely while the patient is connected to you. Third kind of consultation, which is common in the United States, is called VAHOV, V-A-H-O-V. V-A-H-O-V stands for, virtual at-home optometry visit. This is the third care which is allowed for reimbursement. Virtual at-home optometry visit suggests that patient can be in his home or in his office, and you can conduct a remote eye exam providing this kind of consultation. Fourth consultation, a fourth type of care, which I discussed last time, which is called remote patient monitoring in ophthalmology, is picking up. We have instruments which are sent to the patient, or patients rents them from your clinic, or patients buy those, just like the way you monitor your blood pressure, the way you monitor your blood sugar. Likewise, you can monitor your intraocular pressure, you can monitor your OCT level for wet and dry AMD. And likewise, there are many instruments that can be sent to the patient home for monitoring of his visual condition. And the fifth and the last consultative care, which is allowed, which is called consultation, comprehensive eye exam using a remote eye care provider. It means a vision technician or an optometrist goes to the patient's home or to a vision center, whereby, or to an optical outlet, whereby he collects all the findings. All the data are sent to the hospital, and optometrist or ophthalmologist sitting in the base hospital provides the consultative care. So these are 5 kinds of consultations which are allowed as per the reimbursement policies are concerned. And all of them, they have a limit that you can claim up to this much for this particular visit. They have a time schedule, like this particular consultation is allowed for this many minutes, and the guidelines is sent to the patients who are registered for the for this reimbursement policies. As of now, I think in this part of the world, reimbursement policies are not covering, at least optometrists on this. I don't know about ophthalmology practices are covering reimbursement on telemedicine or not. But what is more important is just that we should know what is happening in other parts of the country, and we should move in the similar directions. Likewise, our policymakers should be aware that these are the 5 consultations that are allowed at optometry level or ophthalmology level. Well, this is something which I just wanted to refresh your knowledge on what is happening on the care point of view. Now, coming back to contact lenses, which is why I wanted to discuss this particular topic, is in last 1.5 months, the maximum kind of calls which I got from my patient is that they wanted to replenish their contact lens supply. And if you look at the statistics, most of the contact lenses patients, they will like to go back to their contact lens practitioner. They will like to reach him out whenever there is a supply of contact lenses finished. And when the patient who's using regular contact lenses all the time, he's without the contact lenses in his last pair of contact lenses, it's like an emergency for that patient. And how did we meet up that kind of emergency? This is what I want to explain it to you. Whenever a patient called us, we checked the patient's data. We asked the patient to show us, because sometimes when you ask a patient which brand you're using, which modality you're using, which prescription of contact lenses you're using, the patient may give you a wrong, results, or maybe get wrong information. So rather than relying on patient, you ask the person that please keep your last, the packing of the contact lenses, your contact lens box, or maybe the last, pack of your contact lenses, show it to me live. You connect to the patient the way I'm connected to you, and ask the person, please show me your record, show me what you're using. And take a little bit history of the patient, that was the patient having any problem with the vision? Did the patient had any redness, any allergy? Because if the person is in the last pair, likely that the person is still having 1 or 2 pairs left with him. So ask the person to wear contact lenses 2 hours prior to your consultation, and check his vision, which I have explained it to you last time. How can we check the patient's vision? Check the patient's ocular condition. Check if there is any redness, if there is any watering, if there is any discharge from the patient's eye. If the patient is seeing very clearly for distance, his vision is 6/6, patient does not have a complaint, and patient does not have any symptom with his old pair of contact lenses. After checking the vision with his old pair of contact lenses, I would suggest that you can replenish the contact lenses supply to the patient. Now, coming back, how do we supply when we are in a lockdown? Most of the companies in other parts of the world, they have started a method whereby your data of the patient is shared with the manufacturer of that particular brand, and that data is shared to the manufacturing company, and the company sends the contact lenses directly to the patient's home. As a result, patients get benefited in terms of the pricing, and he doesn't search the contact lenses online. And this is how most of the companies, they are opening up for private practitioners, for individuals who are in private practice. They are connected to their manufacturers and the patient remotely using this modality. Coming back, now what happens is this: fine, you have serviced your old patients who were there. Now what happens is that you also know that sometimes patients want a person who has not been here, he wants a new pair of contact lenses. And the contact lenses, what he has not used contact lenses, but obviously the person is using glasses. He may have glasses prescription. So what I would suggest is just that rather than just uh, saying no to the patient, I would suggest that these are the ways how we handle our contact lenses patients who are requiring contact lenses during this time. Is we take the patient's old prescription of contact lenses, not contact lenses, the glasses what the patient is using, and after checking the patient's vision with those glasses, if we find that the vision is satisfactory and we have the patient's prescription with us, it's very easy that we have a, I'm sure that most of the optometrists, they have a calculator, or there are certain applications, there are certain apps which converts your spectacle power to the contact lenses power. And once that contact lenses power is decided by you, I would suggest that any modality of contact lenses, you have to find a way that you can see what comes next. There are two more measurements what we do in contact lenses. First is the spectacle prescription, and then comes the keratometry finding. And third comes whether you have given a contact, you can check the patient's diameter, the corneal diameter, and all this we can do remotely. And how we have done is, I will explain it to you. We have in our software, which I discussed with you last time, after checking the vision, what we do is this, that we have a way, we do we have a Placidus disc. I don't know how many of you have used. I know most of you have keratometers in your clinic, but since we are sitting remotely, there are two ways of doing it. One way is this, that you send your technicians with a small, we have a portable handheld keratometer, which you can take the keratometer's readings without any problem at the patient's home and get the keratometer reading. But you will understand, and I'm sure that in many countries, most of the contact lens manufacturers, they have perfected the technology to such a great precision that most of the patients, most of manufacturers, they are coming out with a universal fit contact lenses. And many manufacturers in many countries, they don't have choice of base curves, suggest that the technology or the precision is such a great level now that we don't need to have keratometer. We need to have keratometer reading, but at the same time, most of the diameter which the base curve which the companies are launching, they fit about 90% of the patients. And to be slightly more sure, to be very clear about this, what we have is, we have in our software, which I have demonstrated to you last time in the first of my telemedicine presentation. This is the Placidus disc. What we do, I don't know if you, this is a kind of, this goes into your computer screen. And once this computer screen, we ask a person to come close to the computer screen, and this switch off the light of his room, and you can see the reflection of this Placidus disc on the cornea. And from this, if you have a stronger astigmatism or keratoconus, you will see that the rings, the distance between black and white space gets reduced to a quite greater extent if the person has a very high astigmatism or keratoconic condition. So from this, you can get a vague idea that patient doesn't have much astigmatism. Likewise, you have a patient's prescription of glasses, and you can come to a conclusion that this is a cornea, which is a normal cornea. And from this, you can calculate that this base curve, this diameter, and this power contact lenses will work for a patient. But I would suggest that don't be aggressive. At the same time, decide that first pair of contact lenses you send him just as a trial pair. Patients can be sitting somewhere else. Patient is not close to you, and patient could be in another city. So just send a trial pair to the patient's home. Now comes next, how the person learns how to put contact lenses in and how to remove the contact lenses. And we have done a lot of research on these. If you go to YouTube, there are about 17 lakhs videos on insertion and removal technique of contact lenses. And the best what we have studied, the best one which I have seen, and which I would like each and every optometrist who is in contact lens practice, I would like that after my presentation, you have a look at this YouTube video. It is by Dr. S. and on insertion and removal of contact lenses. She's an optometrist. This video, she made this video in 2011. It's most watched videos by optometrists, and it explains very beautifully and explains how you have to be careful while inserting contact lenses and how you have to remove contact lenses. It's 11 or 12 minutes video. It was made in 2011, and since then we have been using this video as our standalone video for demonstration purpose for all our soft contact lens patients. And I would suggest that you send this video to the patient, and once the patient has seen this video, she or he will be able to understand 90% of cases of insertion and removal. At the same time, once the person receives the contact lenses, you ask the person to join online and see whether she or he is putting his contact lenses correctly. If there is slight training to be involved, you help the person for insertion and removal. And after person has done the first insertion, you try and check the patient's vision with the software we have and software you have in your practice, and you will come to know whether the person need any under correction, over corrections, slight adjustment, or the person need a bit mild of astigmatic correction on top of this. Means that the person is okay with this regular contact lenses, or you need to shift the patient to toric contact lenses. So this is something what you can practice without patients connections with you, in the sense that you have not seen the person physically, neither for your insertion removal, not for the first fit, not for the second fit. And then if the patient's vision is fine, then you can order the contact lenses based on your final decision making. At the same time, we have a duochrome test in our software, whereby you can check patient's slight fine tuning can be done by giving slight under correction or over correction on this. And likewise, you can dispense all sorts of contact lenses. But I would suggest that many of you, since you're in a private practice, you should try and look for a safe pair of contact lenses. And for me, the safest pair of contact lenses, what I feel, is the contact lenses which have maximum oxygen permeability. Silicone hydrogel contact lenses are the first preference of my choice. The modality is the daily disposable. This is what I prefer in my practice. And this is what I would suggest that any optometrist who doesn't want a complications. When you are practicing something remotely, you have to practice a product, you have to dispense a product which is safe, which is most easy, in the sense that you don't need the headache of solutions, insertion for cleaning contact lenses. So try and dispense the safest pair of contact lenses. And sometimes you may be stuck that the patient doesn't have a affording capacity. Then you can go in for lower modality, maybe weekly disposable, or maybe monthly disposable. But my first preference would be that don't go for regular mode of contact lenses. Always go for disposable modality of contact lenses. And the 4 companies what we have in India, I'm sure they must be there in Nepal also, OSS for Johnson Johnson's, Biofinity and Air Optics, and this PV2 of Bosch and Lomb. So these are 4 products which Alcon has, Air Optics, and so you can choose any of the products that fits your profile of the patients. And see, sometimes you have patients with dry eyes. Yes, silicone hydrogel have an advantage that it gives you maximum oxygen to your cornea. But some patients, they feel once you shift them from hydrogel contact lenses to silicone hydrogel, because giving them, idea that these lenses are more oxygen permeable, the patients goes in, but sometimes they feel that the comfort level which they had with hydrogel contact lenses is not as much as with silicone hydrogel contact lenses. Obviously, the reason is that there are 2 reasons which I would like you to consider. The first reason is that once the oxygen supply to a cornea is increased by use of silicone material, And so what happens is that the cornea becomes more healthy and it becomes, equally sensitive, just like a normal cornea. While when the oxygen supply is slightly reduced, so there's slight hypoxia with hydrogel contact lenses. So the oxygen supply is not as good as with silicone hydrogel. As a result, the feeling or the sensation what a person has with silicone hydrogel is slightly more for that region. Secondly, as we know, silicone is a slightly, I would say, a binding material. It attracts slightly more different kind of proteins than the hydrogel materials. But at the same time, looking at all the pros and cons, looking at the what we have practiced, what we suggest to you, that except in patients who have severe dry eyes, because I understand patients with dry eyes, they have complications with silicone hydrogel sometimes, but most of the patients, they are very happy with silicone hydrogels. Same times, patients of all categories, starting from toric contact lenses to presbyopic contact lenses to multifocals to now we have UV block in contact lenses, all modality. But what I suggest is before you dispense any pair of contact lenses to your patient, send him a trial pair. Give a trial to the person, let the person try it out for 2-3 days. And after the person has tried the contact lenses, you check patient's vision, check patient's eyes, and check how the person is able to see with those contact lenses. Does the person has any problem? Now you may say that, how do I check the fit? Well, as I mentioned, most of the time, 90% of the time, the first fit which you get with these contact lenses, whether silicone hydrogel, rarely you may get a patient with silicone hydrogel which the lens is fitting too tight. I have two methods of checking the fit. I'll demonstrate it to you. See, the first method I use is I send this clip to the patient's home if the patient is within the same town. He's close by and I feel that the patient doesn't want to come. I send one of my staff, or maybe just by post, I send this clip. I ask the patient to attach this clip to his mobile device, which is something like this. This gets attached to the cornea. Sorry, not the cornea, but the lens of the camera of my device. And now I'll explain it to you. I switch my torch on and I ask the person to look at. Can you see? Now just let me know if you can see my eye clearly or not. Can you see my eyes clearly?
Yes, doctor, we could see it.
Now tell me, what if I had a cataract? How many of you will be able to diagnose this? Or how many of you will not be able to diagnose it? If I had cataract, I've had a mature cataract. What I'm trying to tell you, I'm not talking about contact lenses, but if you are in a remote location and patient, you have this view, can you identify if the patient has any cataract or not? I believe if you are an experienced optometrist, you are able to identify if the person has a cataract or not. So you can see how clearly sitting in Nepal, condition of my right eye. Now suppose you say that, okay, patient is in Nepal, how do I send this device? This is not practical for me to send it. So now what you do is, I would suggest that all of you please download an app which is called Supervision. Ask a person to download an app called Supervision. And this is the app which is, I want to show it to you. Patient, you have not sent this device because it's not practical for you. Person has downloaded this app in his mobile phone. And I want to show you how you can see patient's eyes using this app. Let me try and focus because it has a self-focusing mechanism. Let me see if I'm pressing it correctly. Okay, can you see my eyes clearly?
Yes, doctor.
Yes.
Now I want to see a magnified view of this. You see the bar on your left, which you see on the screen of the computer on the left side?
Yes.
It has a, I'll increase the magnification. See, because I'm using my one hand, but the person can, somebody can help the person. So I'm increasing slight magnification and see what happens when you increase the magnification.
Okay. It's magnified, yeah.
Now, but I don't think it is as clear. So maybe I have to press some I want, because I normally get a very clear picture, which is better than this, which I want to show it to you so that you know exactly what I'm talking about.
We can see it.
Okay, sorry, why I didn't do, I did not switch on the light in this. That's why mistake I was doing, because when I see, I get it very clear picture. So there's a flashlight in this, which will be switched on by using this. And once I switch on my light, now you see. I was wondering why I'm not able to see it. Can you see this?
Yes, we can see it, yeah.
This is what, and I'll take a magnified view of this. This is the normal, see this. You can see fit of contact lenses. You can ask the person to blink. You can check if the patient has any redness or not. You can ask the person to, revert the lid. You can ask the person to change, show the upper lid. And likewise, increase the magnification as much as you want and focus it and see this. I think it will get better focus with this. See this now.
Yeah.
Can you see?
Yes. Even we can see your color of iris clearly.
Yeah, that's what I'm telling you. You can see each and and with there's a software, there's another application which is called AOS, Advanced Ophthalmic Solution, whereby if you take the picture of this and use it send it to the applications, you are able to see you are able to get the exact grading of dry eyes and the fit of your contact lenses. And this application AOS is by Killer, which I explained in my last presentation, which I told you, how using this AOS software you can decide the dryness of your eyes at the same. It does the grading of your dryness at the same time. It does your contact lens fit. It checks the contact lens fit. Now coming to other contact lenses, which is the third category of contact lenses, which I want to talk to you about, is specialty contact lenses. I know that there are not many specialists around for specialty contact lenses. And when I mean by specialty contact lenses, I'm talking of scleral contact lenses, I'm talking of myopia control lenses and ortho-K lenses. So for that, I would suggest that you adopt a method whereby you have a consultant who is expert in any of those three modalities. If you want to practice scleral contact lenses, you talk to the company who is best, who has the distribution in Nepal or who has the closest network in India, and you speak to their consultants and connect with them that this is the patient with which I want to. You should understand what are the indications of those contact lenses, how the scleral lenses can be fit in the best possible way. And likewise, you can't be specialist of every specialty of optometry. Likewise, ophthalmologist, like if he is a retina specialist and if there is a problem with the cornea of a patient, he consults the cornea specialist for that particular. So likewise, you have to be open that you need not to learn each and every specialty of optometry. Get in contact with the scleral contact lens prescriber in India or in Nepal and connect with him and work in random closeness with this person while the patient is with you. He's your patient. You are connecting him for that specialty, for dispensing of that particular contact lenses. For myopia control, if you have an ophthalmologist who works with you for, he works with you for atropine treatment, you work with an optometrist who specializes in myopia control, because in myopia control today, the myopia is on increase, as everyone knows. And when you grow up by another 20, 30 years, by 2050, half of the world will be using glasses for myopia. Half of the world will be myopic, and 10% of them will be very highly myopic. So myopia is growing, and it's kind of epidemic, which we have to, optometry has to take responsibility. And you need to invest, you need to get yourself acquainted with the latest equipments, like not just rely on verification of myopia or monitoring of myopia using the refractive error, but you have to get involved with biometry procedures. If you can afford, have one in practice, or maybe if you can tie up with some ophthalmologist who has biometer, monitor his monitor the axial length more than depending upon refractive error correction, because axial length, you can be as precise as 0.12 diopter, because as you know, 0.04 increase causes about 0.12 diopter of myopia. So you can monitor up to 0.04 millimeter the axial length, measure it at the first time, and as you advance the patient, as you put the patient on atropine treatment, or you put the patient on stack myopia control contact lenses, which are 2-3 of them have been approved by FDA, or you put them on a spectacle lenses which control myopia. Again, and then they will soon be launched in this part of the world. As of now, the 2 companies which have the lenses from, one is Essilor Stellest lens, and there is from Hoya, which is Mio Smart. These 2 spectacle lenses and contact lenses, like the one from Cooper Vision MI Soft, and there's one from Johnson Johnson's, and which is called AQ Ability. These contact lenses are approved for myopia control. And likewise, what I suggested is this, that you have to understand that try and learn most of the procedures with your to do it yourself, but for specialty consultations, for myopia control, for scleral contact lenses, or for ortho-K, I would suggest either you get trained in these particular specialties, because the training of these needs a very dedication on part of optometrist. Not everyone can do it, but at the same time, what I know is just, I didn't do 2 of them, I don't practice, but whenever I have my patients, I never lose an opportunity to dispense those contact lenses, connecting with my optometrist, using all this technology. And optometrist can be anywhere, but I invite them and I practice in my own clinic. Likewise, what I told you about insertion and removal, just the way I told you about Dr. S for insertion and removal of contact lenses, for scleral contact lenses, I would suggest that there is on a YouTube, if you go and watch insertion and removal, this video is made by the Contact Lens Scleral Society. Contact Lens Scleral Society. This was made in 2015, and it has above 1.5 lakhs viewer. I would like that you first learn, you do it yourself, see how you teach that patient on the YouTube, and then you ask the person that, because not every time optometrist will be available for you for this kind of consultations. So what you can do remotely, you should be able to do. But when you want to connect, you should be having a handful of optometrists, ophthalmologists with you, so that you can use the technology and dispense all these contact lenses. So that covers. There's only one thing which I want to tell you about. This only thing is that sometimes you dispense maybe a scleral contact lens, you want to see a fluorescein, and you want a UV light to be seen. In my practice, I have this small device which I attach with my phone, and this again, I don't need to switch on my light here. It has the light, and it has the UV light also. So whenever I want, I'll just try and show you my eyes if I am able to see it. Can you see? This is the UV light. If I had the fluorescent, you can see if there's in a foreign body, you can see my eyes. And if you just press it again, you can see the normal with the normal light. Can you see the clarity here?
Yes, doctor.
I mean, you can see with that clarity sitting in a remote location on your computer screen. You can keep it a picture of it, you can diagnose it, you can send it to another person to, if you were not confident of diagnosing it, and this gives you wonderful results. Okay, now you say that again, I am having a problem, I don't want to buy this device. So what should I do? Again, for many of your interest, we have in our software a slide which I will show you what I have in my software. Now this is the what sorry, yeah, this is what it goes. And once it is portrayed on your computer screen, you ask a person to come close, and from the computer screen, the light it gets into your eyes with the fluorescent light, with the fluorescent in your eye, you are able to see the fluorescent pattern. You are able to see a foreign body, because this is what it gives you, the whatever you want to see with fluorescent in your eye. You, with this being on your screen, you can do it. And if this doesn't work, then we have also worked a technology whereby everybody's phone today have this light. I think everybody has a mobile phone. Every person in a village, anybody, he will have a torch. And we have worked a way whereby we can convert this light into UV light. And how do you convert it? You put a small tape on this light, white tape. Use first a blue marker, because white light has three combinations: the blue light, the yellow light, and the UV light. So how do I take out the UV light from this? I put a tape on this transparent tape. I use a blue marker on this tape. After the blue marker, I put another tape which blocks the purple light. So I should have two markers, blue marker and a purple marker. And once I have done those two tapes on this device, this will become a, this light will become a UV light. Try and do it. If you have problem, look at the YouTube, how to just simply type how to convert your mobile phone into a UV light, torch light. So if you are stuck somewhere, it's not something which I have invented, but this is what I have done a lot of work on this. So I keep on looking for new ideas whereby I can, I can meet up those needs without sending these devices. So go to YouTube, find out, just type what I've told you, and you will be able to convert your mobile phone into UV light. So this is what we can do for contact lenses in remote location. Now, the next topic, Kapil, how much time we have?
Yes, so we can go for it. We have time, sir, no problem.
Are you sure? Because this will again, because I've just touched half of the part on contact lenses.
Yes, so we can go for it.
I can finish the vision therapy?
Yes, we can.
Okay,
no
fine. So the next thing what I want to talk to you about is vision therapy. You see, most of the optometrists, today rely on spectacle and contact lenses. And as everyone knows, I think similar challenges of online competitions, retail chains are giving a very cutthroat competition in the sense of getting the margin on the regular contact lenses and regular spectacle. We are struggling in India, and I'm sure all of you have the same challenge in Nepal too. Now, how do we add on? Because once you have established practice, your expense have to come from some other specialty. And I urge that many optometrists, they should not just rely on spectacle and contact lens field, but they should get into one of the specialty of optometry. And one specialty which I talked to you this evening about specialty contact lenses. And second specialty I want to talk to you about is the vision therapy. Vision therapy is basically a job which is in other countries, they give a very nice name. They call them developmental optometry or functional optometry or behavioral optometrist. And this is what they call, they designate themselves because it gives them a very beautiful designation. But actually, most of them are practicing what we practice, what we conclude as vision therapy exercises. And developmental optometrist, as the name suggests, is related to the development of vision, and thereby you detect amblyopia and treat patients with amblyopia. Likewise, functional or behavioral optometry, how your vision alignment, how your visual axis, how your alignment of the two eyes decides your behavior and impacts on your work, that is functional or behavioral optometry. So as you understand that we can check patients being in a remote location, but besides vision, the visual axis or the eye has many components. And being an optometrist, I will tell you that vision is just one part, the central vision and peripheral vision, which we only study and which we only rely on. But for good performance in any field, whether it is studying or whether it is athletics or whether it is any field, you need a precision vision. And precision vision involves a lot of other factors, and which I will tell you. I'm sure that all of you know the conjugate eye movements. I will touch on briefly what conjugate movements are. The vergences, your accommodation, your convergence, your ability to look at focus for longer duration, which we call accommodation endurance, your flexibility to look at different distances, accommodation flexibility. Like there are many color visions, contrast sensitivity, stereopsis. If you don't have good stereopsis or if you don't have good fusion, you cannot really do a good sports or study for longer durations. So these are so many other fields and besides the vision, and which are very important for our diagnosis, for our normal day-to-day schooling or day-to-day living. And coming back, to first one I will check is about conjugate movements. And I'm sure many of you know, and I don't want to go in depth, but since I'm talking to many optometrists who are students, what is a conjugate movement? Conjugate movement is, the simultaneous, movement of both eyes towards right, towards the horizontally, vertically, to the same axis, to the same degree, and in the same directions. Like suppose, I'll tell you, like suppose I hold this two pen, and if you look at my eyes, and you will know that if I'm looking from my red pen to my black pen, my eyes are moving from one. So this rapid movements of my eyes from one object to another object is called saccades, which is one of the conjugate movements. And these conjugate movements could be not only horizontally, but it could be vertical also. You can see my eyes is going up and you can see it going down. So what I'm doing by measuring this, it gives me a lot of information about patient. It's not just the movement of my eyes from left to right, but it tells me a lot, and which I like to touch briefly is that it is telling me that my right side, when it goes to see the red pen here, my right lateral rectus and left medial rectus is working equally. It means they are innervated by the nerves equally when I look here. At the same time, when I look here, my left lateral rectus and right medial rectus is looking at the black pen. So that suggests that these two movement from one side to another side not only just give me that my saccades are normal, but it gives me a lot of information. It gives me that not only my muscles, but the nerves feeding those muscles, they are getting equal innervation. And if it is not, if my one side of the eye moves faster than the other, or the slower than the other, or overshoots or undershoots, what does it suggest? It suggests not just the muscles, but the nerve behind those. If you look at the right lateral rectus, medial rectus, I remember my school days. I remember the one principle which we use. I don't know if you can just note it down: LR6 and SO4. LR6 means lateral rectus is by 6th nerve, and SO4 superior oblique by 4th nerve, and rest every muscles of the eye is by the 3rd nerve. So you come to know that these muscles are working in coordination by equal innervations, and whether a person has normal neurological function or not. If the person does not have saccades proper, if the eyes is moving faster, so slower, one eye is moving faster than the other, then you can suggest that the person needs a neurological intervention. So it is not just checking the movements of the eye, but it is also giving you a neurological feedback, because every movement, every muscles, every nerve is coming the signal from the brain, and there are different pathways for this, which this is not a time and platform to go in detail. We can do it some other time, but you can learn a lot by these movements. Similarly, coming back, suppose I say, okay, fine, this is saccades. Now I tell you, okay, fine, I am looking only at the red pen, and red pen moves from my right side to the left side slowly. This movement are called pursuits. Pursuit is the slow movement, and when is the slow movement? Slow movement decides your ability to read. When you are reading a paragraph from one page, one side to another, your saccades is not working, your pursuits are working. And your pursuits suggest that whether your ability to move from one page to another or from one paragraph to another is smooth or not. So this is your another conjugate movement. These two movements, if they are not normal, suggest there is a neurological issue with this patient. Coming back to the convergences, this is something of interest to optometrists. This is something which I think what we need to talk about today is what are the convergences and what all we can do, because the topic is on teleoptometry, and this is what I want to discuss to you, what we do remotely with our patient. Convergences is something that what we focus on today. I will not go in any other detail of any other movement, because I don't think we will be able to touch on that. It's already 8 o'clock now. So in convergences, the first thing that comes into play is your convergence. Everyone knows how to measure the convergence. Ask the person to look in the person is sitting at, like I'm patient for you, suppose. Ask a person to ask like, you have instructed me to hold this pen, and I am looking at the camera in front of my laptop, and I am bringing this pen closer to my eyes, and gradually and slowly you will see my eyes coming closer, and you will know whether my convergence is good or not good. So suppose my convergence is not good, because many patients with convergence insufficiency, they will start to feel double at this particular time. You will feel that one of the eye is deviating. One of the eye is not, they are not able to hold. Your instruction should be that please keep this pen clear and single till the tip of your nose. Once the convergence is up to this, if a person is using reading glasses, if he's above 40, ask the person to use reading glasses and measure the convergence like this. And you will be able to know by ask the person to have a calculator. Suppose it gets double here, then you ask the person how many fingers fits in. 4 fingers fits in means 6 and 4 fingers you can measure yourself, and you will know the convergence of this patient is this much remotely. You don't need to call the person for measuring the convergence. Okay, you have measured the convergence is not okay. And what do you do then? You have to look at other ways of, looking at the other test. What you need to do, you need to do the color of the person. You need to do the fusion of the person. Our software has all the details. We have tied up with the Binocs, and we do all the diagnostic investigations of visual functions, of binocular functions using their software. We do rest of the optometric, investigations, but for this we rely on Binocs for getting their software, and we measure all visual functions on their software. And once we have come to know, what do we do? Patients who have convergence insufficiency, I have this small, can you focus? Can you see this? This is called a dot card. This is nothing. This is the name of my company at the back. It gives me publicity. When the person comes to my clinic, I give him, this is my name, location of all my branches. This is what I give it to the patient. And what the person does, Instead of using just a pencil push-up, which we have learned in your optometry school, that okay, ask the person to do it 3 times, yes, it really helps the person to do it. But what I suggest is that we give this and we ask a person, starting from the first point, second point, third point, when he comes, he will not see a straight line, he will see an X, and then he will see inverted V when he is looking at the closest point. So this we call a dot card. And again, you must feel that, how do I send this to a patient? I have it in my, on my WhatsApp. I post it to the person takes a printout, and the person can do this exercise at home. And you can monitor sometimes the person, whether the person is doing it correctly or not. You ask the person the way I'm doing it, and gradually ask a person from this, 2, 3, 4, 5, and strengthen the muscles. As the convergence insufficiency improves, you keep on reducing the time of the person or the duration of the exercise. Sometimes what we do is just that patients feel that, this helps them to improve the convergences. What is more important is how do we improve the fusion? Now for this, we have a card, which is red on the one side and green on the other side. This is called a kind of a barrel card, whereby what you do is just that hold this light, ask the person to look at, just keep it close to the nose and focus on the farthest dot. From one side, he will see a green dot. Am I right? On the other side, the person will see the red dot. Ask the patient to focus on the last dot, whereby he maintains the fusion that half of the circle is red and half of the circle is green. So this way, he improves his fusion by doing this simple exercise at home. So these are the 2 cards. One is the dot card, which is simply black for convergence, strengthening the convergence. This is the one for converging and fusing. And sometimes when I need to, what I do is just that sometimes when we feel that the person is, not able to accommodate well, what we do a marking here. We do like 10, 9, 8, 7, 6, 5, 4 with a black marker. And we tell the person, okay, when you are looking at this, you also maintain the clarity on the dot. Thereby, your accommodation and convergence both are actively participating and both are equally active. Sometimes when we feel that the accommodation needs more work on this, we send this kind of a flipper, which you -2 flipper out the patient's home, or we ask the person to use -2 lenses on top and work with this to improve their accommodation as well. So these are 2, 3 charts what we can send, and these all we have in our WhatsApp. Patient does not need to come to us to have it. You can send the WhatsApp, the person can take a printout. I just took a printout to show it to you, from I took a printout. Otherwise, I would, I could have done this at sending the patient to WhatsApp. Many times patients come to me from most of the people who work in, your most of the IT companies. And in Gurgaon is full of them. And I got many patients who complain of digital strain. And one day a patient came and he said that where I'm going to find this, where I'm going to carry this. So I asked him, what are you carrying? Are you carrying he was carrying a tag like this in his pocket. So, I took out the tag and I studied the tag. I said, let me see how I can. And he was having, I knew that I checked the person had convergence insufficiency. And I said, okay, he said that in my office it's difficult to do this way. So I said, okay, fine, use this name tag. And this tag has a device like this. So this has a thread and it opens up. So you ask the person to start looking at that and keep on focusing at this dot or this circle or this, chain, and keep on bringing it closer, 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 till you are able to keep this in focus. So thereby, patient does not need anything. This I made it for myself. This is my card, and I use it whenever, like, suppose I'm also having a similar problem because I do a lot of work on my computer, and every second day I have this problem of headache and asthenopia, and I do this simple exercise doing this. And this you can buy in any stationery shop, available everywhere in India. So our idea is that we should be able to provide these services or these tools to any home, anywhere, without the person investing in much money or not any money at all, and get the benefit of this. So these are some of the tools which we have. The third, which I have designed, is called a CAT card. Do you see this?
Yes, Doctor.
This we use it for fusion exercises. And this CAT card, what it does is, if you hold this here, and if you notice, the cat has a whisker on one side and the cat has whisker on the other side, and it has a tail. But if you look at one eye, one by one, they will be separate too. But if you ask a person to focus, you will see one cat which has two whiskers on both and tail. This exercise is very good for fusion. This is called CAT card. Again, I can send it to anyone on your WhatsApp. We have the pictures. You can print it. I printed it this morning only to show it to you. Otherwise, I normally don't do it. I just send this to my patients and they do this. So similarly, like a device which is used commonly, which is called Broke string. I don't know how many of you have read about it. I'm sure those who have done in the 4th year or final year of optometry, they must have heard the name of this device called Broke string. But again, getting those sometimes makes it too difficult. So we have designed an indigenous way. I exercise because I play tennis. So I was looking at how do I get something like a Broke string. So what I've done is this: I've devised a simple method whereby I look like this and I look at this dot, and I can manipulate the distance of the dot by bringing this closer or far. So once I have done here, then I bring it closer, I bring it closer, I bring it closer, and then I can tie it at any distance, and this can stretch to any distance up to 8 to 10 feet. So this is nothing but a simple exercising. I used to do it for my stretching and for my skipping, but I started using this for giving this for the patient to just because sometimes these devices are there, and if you check on their cost, this like $30, which I don't think it makes sense. We can make it in 10, 15, 20 rupees at home, these devices, and this is what we need to do. So some of the devices which I have told you what we do for vision therapies, I'll just repeat it again. I'll show you one by one, which we have developed indigenously in our practice. Number one, the dot card. Number two, the barrel card, green and red on one side, green on the other side, whereby you do fusion. Third is that we developed this, just nothing much. We did not develop, but we just looked into it, that you can stretch it and keep on focusing it, bringing it closer, and strengthen your muscles and take the benefit of without any equipment you do it. Then I think all of this for exercises. And then last test we have used is the CAT card. So these are the 4-5 exercises. And then suppose the person still does not improve. As I mentioned to you, we use Binocs software. And in Binocs software, there are two. One is for binocular vision, not binocular. One is for amblyopia. There are two in this. One is Superman and other is Supercar, in which a child uses red and green glasses. Red and green glasses, I ask them that instead of ordering from me, you order directly from Amazon, because it just costs 280 rupees. I send them a link on their WhatsApp. You buy this device. Once you get this, we connect with the Binocs, and we use their software, and it is a pay-per-use software whereby persons can work for their vision therapy, for amblyopia, as well as for convergence and convergence insufficiency and fusion. So they have 4 or 5 exercises on Binocs, which you can tie up with them. You can contact us. And I think that brings me to the end of my both specialty, which I wanted to cover today. And there's a lot. You don't need to expose yourself, at the same time expose your patients to your clinics, while everything can be done in a cheap and effective way. Idea is just that you provide a service. You are a service provider. You are not seller of equipment. You don't get any benefit if you sell a Brock string or if you sell a card, but you can charge for your services. At the same time, patients will appreciate if those services are available at his doorstep without going outside. Everybody has a printer at home. Printout can be taken and those cards can be created the way we have created ours. Well, thank you very much. And I will be glad if there's some questions from any of you, and it will be my pleasure to answer them.
So thank you so much, Dr. Ajeet, for such a wonderful session. And I guess that have inspired many of us to practice tele-optometry in contact lens and vision therapy, because all of these tools and devices that are available on our daily life, and we can use it to improve someone's life, to improve our patients. So herewith, we are to the end of our talk, and now moving forward, we will be on our discussion session. So doctor, we have our questions displayed on our chat screen. So this is just a compliment. So moving forward. So yeah, can you please explain about pegboard rotator, sir?
You see, I'll be frank that I have not used it in telemedicine, and I don't know much, because I like to, because my talk was, I don't think I have seen this application. I'll read about it and maybe answer this next time, because I've not really used it in my practice, and I will not like to comment on something which I don't know much about.
Yeah, sure, doctor. So next question, please. So the device you used was more clear. Can you please name the device, sir?
Which ones? Which device? Because I use many of them. Was it for magnification?
Yes, it's maybe a red one that used for the contact lens.
So which one?
Red one, right? Red one with light.
This one?
I can't
see
this. Let me check.
There are two of them. This is for magnification.
Yes, this one, red one. Yes.
Red one.
Yeah.
You see, this is we made it in house. I'll tell you. You can contact me. This is nothing but a clip-on that gets attached to your any phone. I'll show you how it works. This is your camera of the your iPhone or any phone, but this has a lens which has magnifications. It is a clip, simple clip. We have done it indigenously because I went to China and I bought this device which you saw. But I thought that since there is light already in my mobile, why do I need this? And when I wanted to buy this, they told me that I have to. This was costing me 14,000 rupees. When I contacted them that please supply me few, they said that the minimum you have to buy is 200 pieces, and I did not see market for 200 pieces in India. So I dropped the idea and developed something similar and something better than that at a 1/10 of the cost. This you can get it from us at just 1,000 rupees. This gets here. I'll show you once again how do we use this. This is the camera light on. Yeah. Can you see this?
Yes, doctor.
I'll show you. The light is not on yet. You have to switch on the light, and there's nothing much. I mean, simple camera, attach it here. In some Android phones, the camera could be in the center. In some, it could be anywhere. Just there's a lens here. Put this here, attach it here. If it is in the side, attach it here. So we have used it. We have used it in many places. So you can, Kapil can give my address, and I can share my number. So this is just a magnifying clip, and we can give it to anyone from here. This costs about 14,000, but it's not, because getting it China from 14,000 and then you pay the freight, it comes out 20,000, not worth the money. This just in 1,000 rupees, you can get it at your home.
All right. Sure. Okay, so maybe there is a next question.
Sonu, any other question you have?
Yes, so we have. So this is the end of the question.
It's on both. It's iPhone and Android, both of them, and it's free of cost. You don't need to pay anything. You can just download now on your phone, and you will see a wonderful result from this. It has all the features, magnification. If a person loses his glasses, the person can use it for reading. Patient with low vision, they really help. I find the innovation in contact lenses, but patients normally, this is meant only for patients with low vision, and patients who have lost, who have very impaired vision for reading, and magnification is very big, very almost like 10x or more than that. Try it, and it has a color contrast also. It can change the color pattern. It will show black and white, and then you can reverse the pattern. It has the light built in. It has the automatic focusing, so you don't need to worry to focus, so it focuses by itself. It's a very good app.
All right, so Manish, this is your question answer. It's available for both Android and app.
Yeah.
So we have another question. Okay. All right. This is another question. Can you please share the supervision app link, sir?
Just go to Google, your app store. You don't need to, just app store. You will find it in Android or mobile both. There's no link. If you want, I can send you the link. It will look like this. If you want, I can show it to you how to do it, but I don't think it's very easy. Just go to Safari or Google, just write supervision app, and you will find this app there.
All right. So
if you don't have any problem, contact me. I'll share the link.
All right. So
I'll show you how this looks.
Okay.
It will look like this on your. Can you see this?
So it is a little bit more drizzling. So all right. So maybe we can share the link and screenshot on our official page.
App, just simple supervision.
Okay. So I'll be sharing this apps photo and other information on our official Facebook page. So you can visit our Facebook page after the session. Okay, you can get all this information. Yeah.
Any of you have any issue, you can note my phone number is 98111 42877 98111 42877. You can connect it to me if you have an issue. I'll be able to help you on this. Any of the device, any of the picture you want, or any of the more detail you want to work on vision therapy or contact lenses, we can share more details on this.
All right. Okay. So, all right, we have more questions here. All right, this is another question. So, how to document the paid board rotator? How to measure pursuit eye movement with the help of paid board rotator, sir?
You see, I told you, I've not really done it. I've not read about it, and I've not really practiced it. So it will not be fair for me to share something on pegboard. I can do it in my next time when I'll read more about this and know, because I've not used it in my practice.
All right. So, okay. All right. This is the end of the question. So this is the question that our IT officer had updated on the our screen. So there might be another question. Let me check on the YouTube or on our Zoom as well. So I can't see any question over YouTube and Zoom as well. So maybe we can wait for a few more minutes. Before ending, from my side, I would like to hand over screen to the Solu. So Solu, are you here?
Yeah, I am.
All right.
So I guess these were only the questions that have been raised by our attendees till now. So considering the time limits, here I announce the closure of the discussion session, and I would like to request you all to collect your certificate for this session by joining the link that will provide you on the live chat box. So herewith I announce the end of the today's session. So before wrap up, I request our today's presenter, Dr. Ajeet, if you want to share some few words of honor to our platform.
Solu, I just have a question or maybe a comment. I mean, what I want to know is the feedback from the people who are on your platform. That do they really feel any benefit from this, or because telemedicine is something even new in India, and do they really want to practice, or do they just are learning it for theoretical purpose? So just I would like to get a feedback from you, get a feedback from your people, because you will be giving them the certificates. So get a feedback that are they really getting any benefit from these talks, or we are just, kind of talking theoretical issues here.
We'll be creating a document for the feedback file for this talk, and we'll be sending you all the feedbacks as soon as possible.
Great, thank you.
Yes, actually you can get your all the links for the feedback on your Gmail, or either in our official pages, so you can visit anytime. I request all the participants go through the feedback. The feedback is the thing only that we can see and improve for the next time. Yeah, so I humbly request to all of you to
because if we get a feedback, we know where to improve. You want more theoretical information, you want more practical information, because what we rely more theoretical, you can learn in your college, in your books, anywhere. But what we want to tell you is something that is more practical, which we practice, which we have learned over the years in our field, and this is what we like to share, because that's what our passion is, that we can train optometrists, or we can bring them to the best but highest potential. And our aim is that optometry is developed in this part of the world as it is developed in the rest of the world. Thank you.
Yes, true. And I have a small announcement here. Dr. Ajeet, we are also initiating our teleconsultation from our website. So it's in a process. So we had connected all these, people can only click the one link and they can go to the doctor profile, they can select the doctors, and they can use what we have, the social media like WhatsApp, Viber, Zoom, and the Viber, WhatsApp, Zoom, and Messenger. So we had incorporated 3 different things over there. So they can simply toss this link and they can do a video call with the doctor. So we try to make this thing very simple. So maybe we are launching. This is all the inspiration that we are getting from you. So we are having lots of session on the telemedicine. I'm about to request you for to do the complete course on the telemedicine from the basic to the end of the level, because you have been taught most of the lectures, and we can also collect a few of the faculties. We can take the faculties from the other side. As we are doing for the practical session, we have developed a few of the courses for the practical ophthalmology, and for the we are also going to launch the ocular prosthesis, which contain around like 30 hours of lecture, and we had just completed with the vision therapy, which is almost go for the 60 hours of lectures. So we are trying to develop every sub-specialty practice, and even we have the website which contain more than 22 sub-specialty based course. So you can go to the we are making everything is free. So even we are creating some of the talks, we are collecting three of talks from you, and one is from the from the Canada. So we are collecting the 4 lectures for only for the telemedicine. If we could develop a complete compiled course around containing more than like 20 or 25, it can be a register for the register into the Nepal government as a training program. We are doing the legal procedure from our side.
Is telemedicine legal in Nepal?
Actually, sir, the first we have a government hospital. This is Vihar hospital. We said, and the Vihar hospital. This is the only one of Nepal government hospital, and they are practicing the telemedicine. In the sense, they say the telemedicine is giving the information, giving the information from the videos, and giving the information basically. And we, by their consent, we only can give consultation. We can't prescribe any medication, glasses, or we can't prescribe this thing. But we can take we can only give for them to consultation. Yeah.
I think you need to work aggressively with your government and get this incorporated, because what most of the hospitals are doing is just a kind of I will not call that teleconsultation, because it is just a kind of telephonic consultations and maybe a video consultations. There's much more that can be done to patients, the way we have explained it to you, by reaching and seeing their conditions. Like we are also working with with Dr. Monica Chaudhary and trying to work out it's full lectures on patients with low vision, telemedicine on low vision. So telemedicine is a field which is getting into each and every specialty, and we are very passionate about it and trying to extend it, because accessibility of the patient is most important, and patients in India and Nepal have a similar kind of profile, that they are living in villages where they don't have access to doctors and optometrists, and this is a platform whereby we can reach to each one and everyone.
So I just see the one question from the Deepa Pavel. So even doctor, I'm working as a ambassador for the Oculus, Heidelberg, and a few more companies here. So I work with them for the Nepal, and I I had connected with these companies, and they are highly into it. They are highly into for developing the AI system on their system, and tele practice. They are highly into it. Maybe if we could develop the course, and we can implement in a certain way, in a practical as well. Yeah, we can plan for it. Yeah.
Great, thank you.
We'll be invite you Nepal, sir. No problem.
Thank you.
We can invite you. All right. So Solo, are you here?
Yeah, I am.
Yeah. So go ahead.
So I guess we are to the end of the today's talk, and I would again like to express our immense pleasure and gratitude towards our speaker, Dr. Ajeet. So herewith, I would like to close the today's session, hoping to see you all again in the next session. Stay safe, stay connected. Thank you, everyone.
Thank you.
All right, Ajit sir, we had